ህይወት በማይቆጠሩ ቅጽበቶች የተሞላች ናት። ደብዛዛ ቅጽበቶች ህይወትን ይረብሿታል። ህመሞች፣ ስደት፣ ድህነት፣ ጦርነት፣ የእውነት መጥፋት ብዛታቸው በዘመናት ውስጥ ህይወትን መደበዝዛት በሽታ መጣባት። በመላው ዓለም ውስጥ 35 ሚሊዮን በላይ ህይወታትን ቀጠፈ። በአሜሪካ ብቻ ከተከሰተበት ቅጽበት ጀምሮ 700,000 ህይወታት ተቀጠፉ። በየዓመቱ በአሜሪካ ብቻ 38,500 ሰዎችን ይቀስፋል። ማንንም አይለይም። አንዳንዶች ላይ ግን ይጸናል። ተመሳሳይ የጾታ ግንኙነት ጥቁር አሜሪካውያኖችን በድህነት በሱስ የተጠቁትን ህይወት ግን በዘዴዎቿ ደምቃ የሚያደበዝዛትን ተጋፈጠችው። መላዎች በሰው ልጆች ተፈጠሩ። መታቀብ፣ አንድ ለአንድ መወሰን፣ መከላከያ መውሰድ፣ ከአደንዛዥ እጾች መራቅ፣ ኮንዶም መጠቀም፣ HIV ኤድስ ምልክት ካለበት ሰው ጋር ግንኙነት አለማድረግ። በፈቃዳቸው HIV ኤድስን ለማጥፋት ብዙ በጎ አድራጊዎች ተባበሩ። GTZ ኢኒሺዬሽን ግራውንድ ቱ ዜሮ የኤችአይቪ ኤድስን ስርጭት ዜሮ ለማድረስ ከብዙሃን ጋር ጉዞ ጀመረ።
Hello, my name is Manat Khlmariam. I am the CEO and the founder of ACHI. If you are within the category of or African refugee or immigrant, this is the place to come over. We are willing to give the services that are really culturally competent. Our goal is to really help people help navigate resources, but also we're trying to bridge the gap that exists between service providers and service seekers. I think what's really unique about this organization is there are people who understand who you are, the language of your preference, and the kind of culture that you have. You don't have to really go through a struggle of trying to explain what your identity is, because we truly understand. So we want you to really feel at home, to trust our services, that it's going to be absolutely confidential. A lot of times there is a lot of stigma attached towards dealing with such issues. So we create a very safe environment where confidentiality is the key. I think it's very important that you trust this organization, because the minute you come in to ACHI, it makes you feel at home.
Hi, I'm Alma Burrell, and I'm the director here at Roots Community Health Center. We know that our culture and our culture community is pivotal. We really try to provide that sense of community, especially for those folks that don't have anyone to, they may not have family, or they may be a new immigrant to this country. And so we want them to know that you can come here and we will be your extended family. So when new patients come to Roots, we usually have them check in at the front desk here, and we usually gather some basic information from them. Then we let the provider know that the patient is available to be seen. And so this is our lab, and basically the patient would sit here, and one of our medical assistants would would do a blood draw on them that we send to the lab, and we do just some basic lab work on them just to make sure that our patients are healthy, and to see if there's anything that we need to address.
I'm Mary Nutting, the nurse practitioner at Roots Community Health Center. We offer PrEP services here. Any patient that's interested in taking PrEP, generally we prescribe Truvada, which is a medication that patients who feel they're at risk of acquiring HIV, either sexually or through IV drug use, or patients who may even have an HIV positive mate and they want to protect themselves. We offer that type of support and counseling here, and we can set any patient up with taking those medications and monitoring them and make sure that we do it appropriately and safely so that they can have a productive situation in their own environment.
Hi, my name is Dr. Donald Golden, MD. I'm the medical director here at Roots Community Health Center in San Jose. The underserved community has many different challenges, and we're lucky to be here at Roots because this particular facility, Roots, has a lot of support for the underserved community. People who don't have the ability to optimize their interactions with healthcare providers.
Are you aware of your HIV status? Are you willing to know? That's very easy as you come to ACHI. Once at ACHI, you'll receive so much free access and information about HIV/AIDS and sexually transmitted diseases. You'll also receive behavioural. You'll be educated on proper condom use and benefits of PrEP, healthcare services considering stigma or fear that has been placed before you move on to the initial assessment and screening. Once the initial assessment is done, ACHI will arrange the caseworker for you that will help you to navigate with your medical records, health insurance challenges, cultural differences, language translation, and communication barriers. As we proceed, you'll be referred to Roots Clinic for further medical works and tastings where your caseworker will be with you. The caseworker will guide upon your visit to Roots Clinic and you'll receive most of the clinical care and medical help. After your clinical testing is done and if the results confirm for HIV positive status at Roots Clinic, you'll be ushered to ART treatment and retention to care programs. If your testing reveals for negative results, the Roots Clinic health professional will assist you on the provision of pre-exposure prophylaxis pills or PrEP and condom usage. Once this is done, counseling and wrap-up support will be continued.
Hello, my name is Tedros Solomon. I'm an immigrant from East Africa. I've been in United States of America for the last 1 year. Been struggling in terms of cultural shock, about language, adapting the new environment. The first 1 year it was challenging. I don't have medical service, I don't have social service, and I don't know what to share with my experience. I went to the place called African Community Health Institute. African Community Health Institute is an organization. It helps with immigrant, refugee, and African American and African ancestry people. The service they give is behavioral. Behavioral, it means for a person to survive, it needs mental, physical, emotional, and social health. Step one, they give us education about infectious disease like STD, HIV, and every person is a risk group, and they give us education about sexual health. They empower you with the knowledge about infectious disease, HIV, STD, and the next thing, they make assessment. The assessment is knowing about the backgrounds and what are the options to prevent from the dangers of STD and HIV. Once the evaluation is done, there are caseworkers. Caseworkers are experts which help you with your language, same language, culture and background. They help you to go navigate through from behavioral to clinical. The clinical aspect is Roots Clinic. Roots Clinic are clinic specialized with testing STD and HIV and the clinical aspect. The caseworker helped me to get a service. For my problem was a problem with the medical insurance. The medical insurance, they have a ways. Even if you don't have a medical insurance, there are procedures to get a service. The Root Clinic, they take a background information which is kept in secret where other people they don't know about it. Then you have a conversation with your doctor, and testing is important. Testing is necessary whether you are in a family household, whether you are single, you are married. It tells you about your status and sexual health, where to know. And it doesn't matter whether you are positive or negative, there are a guidance. If you are positive, there are treatments you can get from hospital. They can give you guidance and linkage. And if you are negative, they give you protections. One of the protections we know is using condoms availability, where people they can get for free and it's kept confidential. Other thing is they have a new technology where they use a protection pill. Protection pill, it helps you to protect you if you are from any transmission of HIV, where you can take a pill and the pill protects you during emergency. This is my testimony with ACHI and Roots Clinic, and I support and tell people to get service without being afraid of their personal issue. Just to go straight to ACHI, get service, test it, and get awareness, knowledge about HIV, and get the benefits and the new prevention of HIV with a pill.